So you have your glycolic acid, 7.5 or 15%, and then we go on to beta HD. Then we neutralise your peel, and then we go into the booster and LED if you want to have a booster. So boosters are something that are actually incredible. So when we've exfoliated and extracted and done a gentle peel on the skin, we put the booster on and we can target anything that we want to treat. So we've been using Regen GF as we've introduced Hydrafacial into the clinic. It's a really good all-round anti-aging booster. But we have so many boosters with Hydrafacial to choose from. So the three that I've just brought in, we have Chronopeptide Booster, and this helps with anti-aging particularly. We have Neodermal, which is a bioenergy to recharge the skin's beauty, boost the skin density and overall firmness of the skin. Matrixyl Morphomics Peptide, which is the newest peptide in the Matrixyl family. It's clinically shown to reduce the appearance of expression lines, so one of those. And Matrixyl Synth 6, which we talk about a lot with the Illumia range as well. And this improves the skin's youthful appearance. We also have the Murad Retinol Booster. This is a new one, and it improves the appearance of fine lines, boosts skin radiance, so you get a real glow with that. Not that you don't with Hydrafacial just on its own, but in particular with the Murad, it gives you a huge glow, which is wonderful for any time of the year, but in particular as Christmas and New Year are coming up. And then we have the Ormaravitsa, which is the skin renewal system, which improves, again, cellular turnover. I know I always go on about it, but it's so important that as you get older that you keep up with your cellular turnover. Protection is everything when you're using any of these products, but if you're increasing the cellular turnover, your skin just stays radiant and healthy. I mean, I do use my retinol probably 4 times a week, and I use my Illumia Bright and Clear, which is the exfoliation. So we use that as a toner, but what that does is speeds up cellular turnover. Speeds up cellular turnover, speeds up cellular turnover. So that just helps your skin stay lovely and fresh. It helps with pigmentation, can help with reduce oiliness as well. I'm not actually wearing any makeup today, and I think my skin does look quite young. I mean, obviously we did an endurance run at the weekend, so I'm always a bit puffy after I've done that, but that's just how it is. I accept it. But this is Hydrafacial, and so we have those 3 main treatment pathways. So you've got your standard Hydrafacial, 30 minutes, signature Hydrafacial, which is 45 minutes, platinum Hydrafacial, which is an hour. If you add a booster, you're going to be here for a little bit longer. The boosters are an extra £20 on your treatment. We have packages available for Hydrafacial, so you can have 3 Hydrafacials, 6 Hydrafacials, or 12 Hydrafacials. If you have a package, you can either pay up front or you can pay on Plim. Plim gives us the option to pay over months. So you pay a 25% or 50% deposit on a package, and then you pay over either 2 more payments, 3 payments, 5 payments, or 8 payments. It depends what you prefer and what your budget is. If you are considering having Hydrafacial for thinning hair, we have Hydrafacial Keravive, which is a treatment of 3 visits to the clinic, and then you get your treatment to use at home as well. Hydrafacial Keravive just improves your scalp health and hair follicle strength and health. So that's a 3 treatment course. You can have it every 6 months or every year. And again, you can pay for that on Plim, which is a deposit and then payments depending on what suits your budget. Whichever Hydrafacial course you choose to have, you can have just Hydrafacial, or you can have Hydrafacial as a single treatment or as a course. You can have it as a standalone treatment, or you can have it to complement other treatments you're having. So for example, some patients are having regular neurotoxin treatments or regular dermal filler treatments, and having Hydrafacial after they've had those treatments to keep those treatments looking better for longer. So fillers can last anywhere between 6 and 18 months. Hydrafacial hydrates your skin so much that it actually reinvigorates the dermal fillers, because we're using so much hydration. when you stimulate the skin and underlying tissues, you can draw water into the area as well, so that helps to plump things up and look better from the outside. So if you're stimulating blood flow, obviously everything actually gets better, because when we use Hydrafacial, especially with the lymphatic drainage massage to begin with on the platinum Hydrafacial, we get rid of toxins, which helps to get excess fluid out of the skin, but you also renew the blood flow and circulation in the face, so everything just improves. Toxins are taken out through the lymphatic system. I hope this has been helpful. I tend to waffle a little bit, I'm afraid, but that is what we do in the clinic with Hydrafacial. So standard, signature and platinum Hydrafacial, or platinum Hydrafacial with boosters. Hydrafacial with perks for the eyes or perk for the lips, and Hydrafacial Keravive. You can also use Hydrafacial anywhere on the body, so back, chest, we can treat acne with it, blackheads, comedones, fine lines and wrinkles, improve skin tone and texture, pigmentation. We can improve the skin anywhere on the body, so if you've got dry or dull skin, or acne, or open pores, greasy skin, oily skin on the chest and back from acne, then we can use it for that. And the lymphatic drainage massage is really useful, especially for some of the treatments that Harriet does. So Harriet does a lovely ear candling treatment, and she does a full facial and neck and shoulder massage to increase lymphatic drainage, but she can use the Hydrafacial lymphatic drainage handpiece to show you it, which is here. It's got a really gentle suction action, and it just goes over the whole face. We go over and over the different areas, around and down, all over the face, and Harriet would use it as she needs to improve lymphatic drainage as well. It's a really versatile treatment, and we can tailor a package to meet you and your budget, and we can do it regularly or just as a one-off. But it's a wonderful treatment, it's relaxing, it doesn't hurt at all, and your skin looks absolutely wonderful once you've had the treatment. I think that's it with Hydrafacial. There are lots of different packages available for other treatments to come into Hydrafacial. So for example, if somebody comes to have a consultation, we go through a full medical history, full aesthetics history. I also need to always know about your surgical and traumatic history if you have any. I'll always ask you about mental and emotional conditions that we need to ensure that you're completely safe to have any kind of treatment, especially with aesthetics, especially if we're going to be using invasive treatments such as injectables. If I think about some example treatments that we have, so some people are having a Hydrafacial course of 6, they'll then have a course of 3 of the gentler radiofrequency microneedling, or maybe we'll do a combination and alternate the radiofrequency microneedling and Hydrafacial. They may already have had a year of neurotoxin with fillers, and then we are adding in different skin treatments on the top of that to improve those. So what we do is we aim to improve everything for a patient to feel better about their skin and their health. And it doesn't necessarily have to be anything injectable at all. We can just do Hydrafacial on their own. Okay, that's it. Take care. Hope to see you all soon in clinic. Best way to book an appointment is via consultation, via WhatsApp, and you can contact me on the website, which is elysium.life, and I will get a WhatsApp message if you use the contact page. Okay, take care. Bye.